to the clap to reconvene. And hopefully I'm seeing anxious looks from those who have not yet made their way in. Hopefully the bat signal has been heard loud and clear. We might need one more clap. And any media impact funder folks, I see Vince is shuffling folks in. Anyone else who's out there for media impact funders and wants to shepherd folks into the room. All right, one more time. Woo! Great. All right. We tried. Slowly, folks will make their way in. And once again, remember the second rule: all latecomers get shuffled to the front. So before we step back into our next conversation about the expanding ecosystem of healthcare coverage, and in keeping with the word mischief in my title, I'd like to put up a brief throwback to the March 5th MIF gathering in LA. A lighthearted and mischievous look at our healthcare system from comedian Hasan Minhaj.
You can tell a lot about people by the jokes they tell. I've been doing stand-up for 8.5 years, but I didn't find my voice until I stopped trying to be funny and started telling my story.
I never even knew how my family got to this country. This is what happened 30 years ago in this village in India called Aligarh. Anyone here from Aligarh? You got any Aligarians? Yo, I'm trying to relate, y'all. Any Aligarians up in here? Uttar Pradesh, stand up. No? Okay.
All my comedy heroes were revolutionaries, and they knew nothing's funnier than the truth, or more dangerous. But lately I've been hearing about all these comic uprisings in places like India and South Africa, places with some serious truths. And it made me wonder what stories were being told there, what problems were being turned into punchlines, and who were the rebels saving the world one joke at a time. I decided to find out and bring 2 comics from that part of the world back here to LA to perform with me and my friends, and maybe start a revolution of our own.
Typewriter tip 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 karta hai. I think this is the best defense strategy any country can adopt. Like, make the country smell so shitty that no one will want to invade us again.
It's interesting to see if you can take a poop joke just beyond poop. You know what I mean? Like, oh, what are the social implications of it or whatever?
Yeah, I mean, you do know that anybody who has a toilet is a huge minority, and it's not just here, it's around the world.
Is that human or animal? I don't even know.
That's human.
At my next stop, the comedy was way more black and white.
White people don't think of going to jail. Jail is so far away. As a black man, you think of jail at least once a day. At least once. You wake up, breakfast, jail. Okay, sure.
One of the biggest things that helps prevent HIV is circumcision. I don't know if this is a penis or a goth chef. We went to the township. We put him in a big black penis outfit that was circumcised, and we were dishing out the brochures. If you remove the skin, it'll look like this. Snip, snip. I'm gonna miss that dick, you know? I'm gonna really miss him. Race is the topic of discussion.
As a black guy, we do kind of blame apartheid a lot. You know, you have a guy with a headache, you be like, hey, what's wrong? I think it's apartheid.
I'm supposed to be meeting this guy tomorrow. He's kind of this young up-and-comer. His name's Mpo Pops.
Our parents were just happy that we're going to like a predominantly white school. They didn't prepare us. Like, you're gonna meet Indian friends, and this is how they talk. You're gonna meet, they were just happy we're going, okay, bye. Come back and talk English, okay? Don't come, if you can't talk, don't come back, don't.
To me, following the joke, following people's narrative, that's the coolest thing.
Ekasi, abanyazi, ngilala phansi, sure.
This stuff isn't just contrived in a joke book. This is real life. All these guys are taking these big chances. They're creating the rules as they go along.
Part of the magic of comedy is that you can force people who disagree with you or even hate you, you can force them to listen.
That was mischievous. I think that counts as mischievous. So I would like to introduce and thank our host next. I'm going to call up Mr. David Rousseau, who is the Vice President and Health Policy, Media, and Technology Executive Director for the Kaiser Family Foundation. And so thank you for hosting us today, David. And please segue us into our next panel.
Thanks, Matt, and welcome, everyone. We had invited Hassan to be here, and I think I'm actually glad he couldn't make it because it's hard enough to follow his video. I wouldn't have to follow him in person. I think it would be even more difficult. But welcome to the Barbara Jordan Conference Center. We're really pleased to welcome you here, and I'm really happy with the program that Media Impact Funders has put together. Thank you, Vince. And I'm really particularly excited about the next panel, which touches on issues very near and dear to our foundation's heart, to health policy and media, and to collaboration, which is really what we're about in most of the projects that we do. But first, before we get into the substance of the panel, I'd like to introduce our moderator today, Elizabeth Christopherson, who is the president and CEO of the Rita Allen Foundation, who is also a longtime participant and supporter of public media, as well as a fellow board member of Media Impact Funders. So welcome, Elizabeth, and thank you all.
Thank you, David. It's wonderful to be here with all of you, too. Now, it's my job to let you know that while Matt's introducing game theory to all of us and play, another big trend we haven't talked about is how everything, sound bites used to be a certain length, and now they've gotten shorter. Well, panels also have included much more content, too, and they're going to be a little shorter. So we have to stay alert. We're only going to go first names as we bring the panelists up. We're going to have hear some of their collaboration, and we'll have a little discussion in between and end with another trailer, too. So it's a lot that Vince has helped us stick it. Yes, Matt, and I've forgotten something else. I know it keeps changing.
You didn't forget anything. I forgot something. We've been hearing dings all throughout the sessions today. So if you could silence your cell phones if they've got dings or anything like that, just so we can hear what Elizabeth and our panelists have to say.
Silence, tweet, take photographs, answer your emails. But in any case, we'll have some fun with this. Anyway, Peggy, would you come and join us on stage here? Joe also, and Bill, and we're going to get right to it because as we do, David, we're delighted to be here, but I thought rather than reading your titles again, reading your bios, these are incredibly talented people with lots of awards, public recognition, doing important things too, and by the way, I think this is, as we've been networking, a audience that could take their turn and will take their turn, I think, at future panels too, and seem to have many connections with the panelists up on the table here. So if I might ask you just quickly to say, how do you spend 80% of your day and what interests you most? And we'll do it in a soundbite.
Well, I actually have a small business that I run on the side with a family of a 5- and 8-year-old, and I think I spend most of my day planning their after-school activities and other things, but I'm not planning the events that we do here at Kaiser.
If I'm being honest, I'd say talking to other people about what we're about to do, as opposed to them doing it.
Yeah, and I think I spend most of my time thinking about my job, so.
I didn't think about putting this on. I spend a lot of time raising money, so I would say that's probably almost 80% of what I do at the center.
Great, but it all adds up to something important. So the way we thought we'd work this out with all of you is here from the first three people, David, Peggy, and Joe, about an incredible collaboration that's going on and what's working, to give some context, and then to hear about from Bill a little bit about also having orchestrated some wonderful collaborations and an exciting impact in the work that you're doing, Bill. We'll hear about you two, and then we'll have a little discussion with all of you before we'll have to wrap up. But Dave, why don't you tell us what's going on, what started this, and why are you doing it, and what does it mean?
Sure. Well, thank you, Elizabeth. This collaboration is, I think, one of the most important things Kaiser Health News does. It's a way to get outside of the Beltway to cover a story that's really local in its core. Health policy is really boils down to people's interaction with their doctors, their hospitals, their insurance companies. And for a DC-based news organization, Kaiser Health News, and NPR-based here, I think it's very important to get into the community. And what we're going to talk about today is how we've done that through this collaboration. But first, a little bit about Kaiser Health News. I wanted to give you a quick overview. We started Kaiser Health News about 5 years ago in June of 2009, so about exactly 5 years ago. And it was a really proportionate, I think, fortunate time to launch a health news service. June 2009, if you might remember, was when Congress started debating the Affordable Care Act. And a lot of news organizations across the country had downsized, and some of that downsizing involved losing expertise in health reporting and health policy reporting. So I think we had some strong tailwinds to help us with a lot of interest in media partners in covering what became a really big story for a lot of news organizations. We provide in-depth coverage of health policy issues. The Affordable Care Act is probably the biggest health policy issue over the last 5 years, but there's many other issues that we look at, as you can see from the reporting that we have. Our primary distribution strategy from the start was to work with other media organizations, many of which are public media organizations, are some of our best and strongest partners like NPR. But we really started with an approach to try to build out a distribution network that would let us get our stories out to other places. Although increasingly with social media, we drive traffic to our website, which I'll talk about in a minute as well. We created Kaiser Health News as an ongoing editorially independent program of the foundation. So rather than give a grant to an external news service, our board and president felt so strongly that there was a need for better quality and more health policy journalism that we created it as a program of the foundation. So its operating budget, its staff salary for journalists, its travel expenses, everything is part of the foundation's operating expenses. So it's an ongoing commitment. You could think of it as an endowed nonprofit news service, which is the commitment we made to keeping Kaiser Health News strong and giving it the ability to be sustainable. We also recognized that as a news organization, it needed editorial independence from an organization that sponsored it, and also transparency in where the sponsorship comes from. So we put our name on it. It's Kaiser Health News. We're not hiding who's sponsoring it. But we also set up a national advisory committee, and we're fortunate enough to recruit Len Downey to chair that committee, who advises us on all of our issues that come up about independence, about covering Kaiser in the news, Kaiser's health policy work in the news, and really has given us guidance throughout in working with partners and positioning ourselves strategically. We're also very fortunate to have a very talented group of other advisors who help us on a wide range of issues with partnerships in new emerging technology and in thinking about how we operationalize Kaiser Health News. We also have a great editor-in-chief, John Farahall, who's came from us from the Baltimore Sun, and Peggy Girshman, our executive editor, who are editorially independent from me and our president and our board. So we give them input on what we think is important stories, and then they decide what to write and what to publish. The website that I mentioned, Kaiser Health News, is undergoing a renovation right now, so it'll be relaunched in a new mobile-friendly platform this summer at some point, but we have seen increasing traffic to the site. Originally it was basically a distribution model that we sent things out, but now with social media and a lot of other forces, we bring a lot of people back to our site to look at our stories. Our media partners are a wide range of commercial and public media. These are some of our most regular partners, but we work with hundreds of different partners when we write and place stories across the country, and that's become a lot easier to run stories in multiple media sources now than it used to be, where you would really get one partner and they wouldn't want to run it if someone else had run it. It's become, in today's media ecosystem, possible to run a story in many different places. So this is a quick look. This is our we call it affectionately our Kaiser octopus. It's a friendly octopus, and this is basically our approach to distribution. We have a daily email that we send out to editors with our story budget that goes out with what stories we're producing and what's coming. Our NPR partnership, which we'll talk a lot more about, is a huge part of our strategy and our approach to getting stories out. Our stories go out on the Gannett Wire. We send them out through all sorts of different feeds. Washington Post and Bloomberg Wire pick up some of our stories. All of our original reporting runs on WashingtonPost.com in the health and science section, but the Wire gives it a much bigger distribution when it picks up stories. AP Marketplace runs our stories as well and is available to all AP subscribers. And we have a consortium project with 8 regional newspapers that Peggy's going to talk a little bit about in a second that allows us to run their stories and for them to run our stories as well, and to really collaborate with each of them about how to cover health policy in their local market. And then lastly, through the grapevine, we'll write a story that has a national hook and data that could be localized, and it'll wind up being picked up in a lot of places. So a quick example of that is a story we did on hospital readmissions, and it doesn't seem like the slides are advancing. Oh, there we go. This is one we did that the New York Times partnered with us on to look at hospitals and their Medicare penalized when they have too many readmissions, and there was a data dump that was released of where those readmissions happened. We wrote a national story, and then hundreds of other places were interested in localizing it, so we were able to get, some of them worked with us to localize the data, some of them did it on their own, but a story like that with a data hook that's national increasingly can have a lot of local redistribution. That's part of our ongoing strategy to increase it.
Still working on the Montana-Wyoming strategy.
Yeah, we're a little barren in the mountain states. So with that, I'm going to hand it over to Peggy to talk a little bit more about our consortium.
Do you have to
You are.
switch it?
Okay, it
Good.
says I'm on. So,
Wait, actually, can you hear?
am I on? Yes. Okay, cool, thanks.
Did you press the?
Yeah, I did it twice,
Okay,
so
okay.
I probably rejected it in the end.
You've got a nice voice.
So David briefly mentioned our consortium project. We're going to sort of back into the NPR project here. This is something that we started in the last year and a half, and we're partnering with, I'd like to say 8 newspapers, but it's really 7 newspapers in the Texas Tribune. But these are major newspapers. We're thrilled to be talking to them. It involves some money for them to expand their reporting coverage, but more importantly, I think, than that is the weekly call, the daily collaboration. They pick up our stories, we pick up their stories. We help discuss with them the best way to cover these local things. We're not their editors, of course, but it's increased enthusiasm. One example is at the Miami Herald, the editor on this project who's in touch with us, she was not a health specialist at all, and she came here for 2 days, and she went back all nerdy, and now they're doing a great number of stories on this. They're among the best coverage in the country in terms of local healthcare stuff. And so I think it really advanced that. We also have recently established an on-air partnership with the NewsHour. We've talked on the NewsHour, we've done lots of things with them. We're on their website all the time, but this was the first time that one of our reporters, Sarah Varney, did an actual piece that came out of her intimate knowledge of what's happening in California. And it was about how she actually followed inmates as they came out of prison, and then they went and they got signed up for Medicaid. We hope to follow them more when we see what they actually use once they get their cards, which hasn't happened yet. We want to see what they do and what the reaction is to that. So we're really looking forward to following this up. So we also have, we had a big story with ABC that took months to do, and it was about how much CEOs get at nonprofit hospitals, which is a lot. It makes you sick. Oh, sorry, I didn't say that. And then we also have had regular relationship with C-SPAN, where our reporters go on and discuss things. And we did a huge special as the, is that for the Supreme Court or the healthcare law going through, starting October 1st. So we have relationships with them, and it's really nice. But the thing that we're up here for and we're incredibly enthusiastic about is our relationship with NPR, which partly started because I used to work there. And Joe and I have been friends for 25 years.
At least, yeah.
So it started with us hiring as one of our regular reporters early on, Jenny Gold, who had been a Kroc Fellow at NPR, which was the ultimate in philanthropic
She was in the
investment.
first class, actually.
Really?
Yeah.
Anyway, so she had learned radio. This is a great project if you've never heard of it. Joan Kroc gave a lot of money to NPR, and they used some of it to bring up the next generation of radio journalists, and Jenny was among them. So I was thrilled that she could come work for us because she already had ins at NPR. They knew her reporting. Joe knew her. And so we started providing stories to NPR that we talked about in advance and ran on the air and also on the website. Then the next thing we did is we hired Sarah Varney from KQED, which is a fabulous healthcare reporter, and that we made her responsible for California and the West. So this story, she went to Texas. It was a great story about the Rio Grande Valley and how there's a stark difference in how healthcare is there and the rest of the state. So she was there for a while. This was a very successful story. Then we started our station project, which involved, it was our idea to do it in a way to work with member stations to increase, the first thing was to increase local capacity to cover this unbelievably important story. And we started this in the year that the law passed. So this was, or took effect, I should say. And it was an unbelievably important time. And I think stations, newsrooms are not exactly full of reporters. Some of them, even the big stations, I don't know if Laura Walker's still here, have maybe 5, 6, 8 reporters, you know, even big ones. And a lot of them had, this is one part of their beat and something else is one part of their beat. So we really wanted to help them cover this story locally. And we invited 3 different groups of, we had an RFP and we said, apply to be part of this program where we will help you. There's no money changing hands, and we will help you cover this subject. We had a producer at NPR, we have a producer at NPR, and an editor here. We hired the editor, NPR helped hire the producer, but we all collaborated on what that was. This was all so natural because we all knew each other back and forth. And Joe had been a Kaiser fellow in the journalism program, so
Yeah.
we knew the building already. And so we got over 65 stations applying for this. We picked 24, we broke them up into 3 groups, and there was an astonishing range of knowledge from nothing to a lot being in Boston, I think was the most prominent. And we broke them up, we brought them together for like a few days boot camp, and then we sent them out back to their stations, and we started working with them. We thought mostly on local stories. The idea was it would be nice if like once a month we had a story that went national. Well,
Yeah, the real goal, I should just break in.
Yeah.
The goal was more to increase the station capacity and hope that it would trickle up to the network. We were doing enough, and we have a large national staff. We felt like we didn't need additional stories until we found out that we really did need additional stories. Yeah, go ahead.
it was really natural growth, and of course not all of those 24 people were as enthusiastic about the topic or as able to cover it. One thing that was really important when we did the request for applications is we made them have a commitment from their station manager and their news director to do this, because we did not want people coming who then had to cover fires the next day. Why do that? The whole idea is to build capacity. So we had really enthusiastic news directors, which was key. And then we renewed the project the following year, thanks to the foundation, and then we whittled down to what we thought was going to be 8 or 10 reporters, but we keep adding people. Like this year we added Cleveland Station, which isn't even on the map, I just realized, because it was so exciting to get somebody from Cleveland, which is huge in healthcare. So we have now 18 people around the country who are producing stories. This is our initial group. Isn't Joe so cute?
No,
And we do the selfies. And then, so we're in many places. So those are the combination of the consortium and the member stations is we're really all over the map, except for, of course, Wyoming. We can't trade for, although the paper pieces.
Yeah. So I will pick up by talking about a little bit more about the partnership. Peggy mentioned the workshops. They were very intensive in the beginning, except for a couple of the reporters. They brought not a lot to the table in terms of healthcare knowledge, and that was really the goal, was to give, the healthcare system is so incredibly complex, to give them as much knowledge as we could pump into them in a week upstairs on the 9th floor here and at NPR. We brought in health policy experts, we brought in political experts. Kathleen Sebelius came and talked to us, I think, during the first workshop. We gave them a lot of radio production tips and techniques, storytelling, and that helped them just in everything that they did. But when they went home, they were so enthused about this and this was really an unanticipated effect, was that the news directors were like, oh, yeah, we really need to be doing more about healthcare. And they gave them even more, the news directors gave them even more license to cover healthcare than we had ever expected. So they're now, are we in the 3rd year of the project? Mm-hmm. Yeah. There have been, I forget how many hundreds of stories produced locally. Nationally, we've put on at least 200 stories. The way it started in the beginning, Kaiser was very interested in getting material for their website, so we gave them a lot of training in writing for the blog, so they were producing blog posts. And then little by little we got more into the radio, and as Peggy said, we thought we'd get one a month on the national air, and I think we've had...
We went up to one a year and
One
a week, and at the last count, we've already done like 2.5 a week as of now this year, which is actually a pace that is not sustainable.
No, it isn't. And
so
your mic wasn't working.
It wasn't working, but I really did turn it on.
Anyway, so this is just one example of what we were able to do. So about 2 years into the project, came implementation last October 1st, which, hit everyone pretty much by surprise that it was such a big mess. But during the first 2 weeks, we were able to put on all these stories from the field, in addition to all of the stuff that NPR's staffers were producing, just dozens and dozens of stories. Each show had 2 or 3 or 4 stories. And this gave us a more complete picture of what was going on out in the country, helping us to, as Laura Walker said, sound like America. I'll talk, maybe in the Q&A, I can talk a little bit more about how we'd like to improve the diversity of the project, and that's a systemic problem in public radio. But that's really the only downside. And let me go back a couple of slides. I think we've covered a lot of this. We have, as Peggy and David have outlined, we've had a lot of impact. I just wanted to, I asked Giselle Grayson, who's the producer on the NPR side, who had worked at NPR on and off for the last 8 or 9 years and had a dabble. She'd been on the science desk. We have, our health coverage originates on the science desk at NPR because health at its root core is a scientific subject. And it morphed over the years into much more coverage of health policy. And Giselle has, along with all the other reporters, become a healthcare expert in her own right. And she has, in addition to setting up these workshops and running them, she and Diane Weber on the Kaiser side provide one-on-one mentoring to each one of these reporters. And I'll just read you one quote from Elena Gordon, who is now at WHYY, but was at the Kansas City station when she started. She says, "Having this project makes me a better reporter, and my sources know that. The state Medicaid agency knows that I have knowledge about the ins and outs of the law, and they're comfortable providing me tips and more candid interviews than she was getting before. And that's because they trust the reporting." And this is what we hear from all the reporters in the project. They now get stories tipped to them from various state officials. They're able to cover it in a very deep way. And from a news director, I just read this quote. John Dankowski, who's at WNPR in Hartford, who was one of our first and greatest supporters, said, "This project has been an invaluable resource to our station and, more importantly, to our listeners. First, we've now got a reporter with the background to legitimately cover healthcare and the Affordable Care Act. That's not something we had before. But what really made the project work has been the support the reporter Jeff Cohen has gotten from DC, dedicated producers and editors who cultivate ongoing story conversations that lead to compelling, informative, and important content." So, I mean, that's what, growing the system this way has been a really important goal of this, and I think we've achieved a lot. And I would just talk about impact, because this conference is about impact. Just mention a couple of stories. Christian Fodenwenzel of Oregon Public Broadcasting did a great job when Oregon's healthcare exchange broke down, and they went to paper applications. And if we had not, he broke that story. So he broke that story. He also looked at one of his better stories that actually resulted in a change. The Oregon Exchange had a star rating system on each insurance company and insurance policy. And he looked deeper into it and found out that the star ratings were being concocted by a consortium owned by the insurance companies. And when that got fresh air of broadcasting and on the web, the Oregon Exchange changed that. We have a reporter in Florida, Lynn Hatter, who was in our first class. She uncovered an insurance brokerage scheme that was going on in Florida. Soon after it was broadcast, the brokerage left the state. So, I could go on and on. There are several ways that the project has had an impact on policy, and more importantly, it's also explaining to people what is going on and how this thing works. And that in and of itself is a hugely valuable service. And do you want me to play?
Yeah.
Do we have time?
Just this little clip. It's less than 30 seconds.
Okay.
Of course we want to see a clip, don't we?
Yeah.
No, it's not seeing. It's just a tiny
Hear it?
clip.
Hear it. All right, good.
So this is from. let me set it up a little bit. This is Jeff Cohen from WNPR. This was a wonderful story. He played the tape at a workshop, the raw tape, and I instantly knew, wow, this is something we've got to get on the air. And he's a good reporter and a good writer, but with some, the editing that we could supply from Washington really turned this into a remarkable piece about a schizophrenic man who'd been in and out of state hospitals and other treatment facilities in Connecticut. And this was all about the time. It was loosely related to Newtown,
and
right?
It was one of these hidden things.
Use your mic.
Okay, sorry. It was a hidden thing. It was sort of ordinary garden variety crazy person as opposed to Newtown. So he was really great at pursuing this because it wasn't famous.
And what we were able to do was provide him with the storytelling skills, the radio production techniques to turn this into a magnificent story. And I just want to play you with 30-second. Didn't I just tell him?
The collaboration is so
Yeah,
strong that they're
coaching
working
on the
on each
scene.
other's sentences.
Listen, we've known each other 25 years, work wife, work husband.
So let's hear this, and this will be
What
great.
happened
Set
is
up.
there was a small story in the news where a guy who was mentally ill decided to kill himself in a very public way. And as you may know, the suicide rate among people who are mentally ill is much more concern than the violence upon other rate. And so he lay down in front, he's about in his 50s, and he lay down in front of a bus and the bus driver couldn't stop. And so this was actually on the news for like 30 seconds or something, it was a crazy man, and he wasn't white, and so nobody cared. So, go ahead.
So this was, Jeff sat down with the family for, I don't know how long the interview was. He had hours and hours of tape, over several days. And this is just the mother talking about the dilemma she found herself in when the son, I guess he was in his 40s when this was the 50s, when this happened, and how he was so disturbed that they were afraid of him, the family was afraid to let him in the door. And can we play that?
Saw that fear. Nobody understands what I'm trying to say. It's not the idea of feel guilty because he passed away. Maybe I couldn't have helped that. But what bothered me is no matter what nobody does, I'm still his mother. I was supposed to let him in that house to help him because I saw the fear, but I didn't know what to do. And then I went to the window and I heard him said, "I'm waiting for mommy." I heard him. I'm looking at him. I walked away from the window. I said, "God, what do I do?" I said, "Geez, I didn't even know what I was going to do."
And the story, we could play the whole 8.5 minutes, but it goes on, really laying out just the years of effort to try to get this guy into treatment and ultimately failing. So I think this was one of our most successful pieces, and I think it's won at least 2 or 3 awards. So.
Oh, we have tape of the last thing he left on their answering machine, which we could play.
No, we're not.
Anyway, go online and find it.
Actually, let's segue here because I've been thinking about this. We have Vince and his great team here have added so much richness here. This is almost like having the proverbial campfire, if you will, that people get a chance to tell their stories. And the stories are so complex, the topic is so large, there's so much richness here. I know you deserve to be so proud of the work that's been accomplished. We have some larger questions. If we have time, we'd love to come back to you. But I also want to give some time to Bill Buzenberg, who many of you know in this room and admire his work too for the tremendous things. It was a great year for you. What kind of prize came your way?
I'll show it here in a minute.
Well, you all right. We'll enjoy hearing a little more from you, Bill, because a lot of tremendous accomplishment also here to balance, I think, the contextual storytelling that we're sharing. And we'll go back. Thank you.
As you're getting up this one, I just want to acknowledge an esteemed board member in the room, Mr. Mischief, and a former board chair, Geneva, is also here.
Great.
Listen, I used to be in the cockroach radio business, and now I'm in the internet broadband business. But it's great to be here, and I have to say, we wouldn't be here, the center wouldn't be where it is for 25 years without the support of so many people in the room. So I'll just start there. I'm going to talk to you about 3 projects real quick, if I can. This is the one that won the Pulitzer last month, and we just picked it up last week in New York. I just will go over quickly what it was. It's a story. We had a reporter working for a year on it, 28-year-old guy who came in as an intern, great reporter. We started this with NPR, is what I was thinking, with Howard Burkus. We found that black lung disease was soaring. We all think it's going away, and it was soaring. That was the project we did. But he kept going back to coal country and finding out all these miners can't breathe, they're on oxygen, and they can't get any benefits. And again and again and again, he said, well, why can't you get benefits? Well, there's these doctors at Johns Hopkins University and this law firm, and they go into court against us and prevent us from basically getting any benefits. These are hundreds and hundreds of miners. So he collected 1,500 medical records from the families, and we started going through it. The day the story came out, Johns Hopkins suspended their program. They were embarrassed by it, as I think they should have been. Our partner was ABC. ABC did a great job on television with an evening nightline and on the evening news, which was really good. This is a data visualization. You can't quite understand it, but if you run your mouse over any of those dots, they pop up a case. Those are 1,500 medical cases of people with black lung. The doctor on the left, Dr. Paul Wheeler from Johns Hopkins, said, oh no, they don't have black lung. Those are all doctors in the same cases who all said, yes, they do. And when we showed that and showed that to Johns Hopkins, that's what led them to change it. Some of the impact, the Labor Department jumped in immediately and started changing the way miners get their benefits. They issued a report, and usually when the government issues a report, they don't put the name of the news organizations in the top line when they're making orders, but they did in this case. And it's had the effect of miners now getting benefits, and that's a really good thing, and I think that's why it was honored, and it won a number of other awards, and unfortunately I lost the reporter, but anyway, he got hired away. But it's a good project, and I'm proud of it, and even today we're still following up. There's a medical ethics investigation going on. There's the law firm involved. We did a whole story on the law firm, which had withheld evidence again and again and again. A number of lawyers were let go, and ABC today actually has a follow-up story that they're running, that we're running, based on this. So I'm just going to move quickly. This is another project I want to show you. We started this actually with the Wall Street Journal. We sued to get all the Medicare records for 10 years. And then we went through it, they went through it, but what the story we found was how, in fact, the medical community is essentially upcoding, basically saying they're spending not 15 minutes, not a half hour, not 45 minutes, but an hour with most of their patients. And they can do this with a click of a mouse, and the upcoding meant billions of dollars. This project came out a year ago. It cost $11 billion extra because of the upcoding. And that led to a front page story in the New York Times, and then the HHS stepped in and said they have to look at this much more closely and audit it better, which they clearly do. Well, today we just launched another project. Well, we had to sue to get some more information, and this suit is ongoing right now. But what we wanted to get were more of the Medicare Advantage files. And this is up on the website. You should look at it. It is on Kaiser Health News, I'm happy to say. NBC also is carrying this story today. It's going to roll out over the next 7 days. This one costs the taxpayers $70 billion, the way that we could see in the data what was going on. And it's not the other kind of upcoding. It's a different kind of upcoding. But basically, they are saying that people are much sicker. They have a risk assessment. So suddenly, we can see in the data that the risks are going from their normal risks to everybody seems to be at the highest level of risk possible, which means billions of dollars for the companies. And I think there will be some sort of reactions to this as it rolls out. But this is today's story. Again, we spent just about the last year doing it. And part of our work is all with data and documents. That's the way we like to work. And people may not like it, but they have to respect the work and know that it's very solid when it comes out. Now this next, if I can go on here, this really isn't about medical, but I just want to show you the way it's working. I mean, you saw all of the people that their work is showing up on newspapers all over the country. That's what's changed in the last few years. The work we're doing is showing up everywhere. In fact, it's globally showing up. This is a project we just did on appellate court judges. Okay, they're supposed to fill out forms for disclosures for conflicts of interest. There's lots of transparency in this country, but nobody looks at it. So we collected over the course of the last 8 months every appellate court judge disclosure statement. Some are 60 pages long, and then go through them and then look and see where they in fact have investments and have they ruled in those areas. 255 appellate court judges. These are the people right below the Supreme Court. Well, in fact, we found 24 judges that have investments in ExxonMobil and in fact are ruling in favor of ExxonMobil, which is illegal. And what we did is wrote to them all, because we always contact everybody that we're going to be reporting about, and we got back 24 letters admitting that these cases were tainted, that they can be retried, and the retrials have already started in some cases. So this is just to give you a sense of how does a story like this roll out. So here's AP, the Wall Street Journal, the Daily News in New York. This is the Cron in San Francisco and the Washington Post. That's sort of the newspaper world. This is Fox News, and then this is NBC. Both did work on it. On the digital world, it's HuffPost, the Daily Beast, the Gawker. Then there's all of these journals that started using it, the ABA Journal, and all of these lawyer societies from all over the country picked this up and ran with it. And the basic point is, I think when you're doing this watchdog work, if I'm an appellate court judge, I will no longer say to myself, I have that stock, but it really doesn't matter. I can still go ahead and rule in this case because no one's really looking. They're going to know that actually someone is looking. There's a watchdog out there, and they probably won't do the same thing again because it's embarrassing to have a case retried because of their stock. But this is the way the world is spreading with these investigative centers. Their work's showing up everywhere. So I ran through it. I think that's it. And I'm happy to talk about any other part of this.
And the Pulitzer Prize.
Yeah.
Well,
yeah. Yeah.
Yeah, yeah?
Yeah, no, it was a great thing for us and for this young 28-year-old reporter. We have always wanted to do that. I've always wanted to go to that lovely luncheon in New York at Columbia University and sit under the rotunda and have our name read out and talk about, yeah, we won that. So I'm obviously very proud of it, and it's been a very, very good year for the center with all of the top major investigative journalism awards from the Goldsmith and the Polk and on down. We've won them all, and for lots of different projects. So that's a nice thing.
So much excellence here, so much to take great pride in. And I know one of the things that we're talking about, Carl outlined, I think, the number of issues that funders are talking about in this space. But one issue to get really honest about and talk about, because I think your business model, your funding model, is that question of sustainability. We noticed that, for example, we also fund biomedical research. There was an article about how billionaires are funding diseases they're particularly interested in. Is there an analog to this in the sense that trying to find funders match stories or match interests? You may feel that there's an imperative, a news imperative, an investigative piece that is imperative, but talk just a little bit about some of the barriers to doing more of this excellent work and doing it in a timely fashion.
Well, I do spend a great deal of my time raising money. I think that's normal. I expected it. I actually enjoyed it at NPR. We did really well. We doubled the size of the budget there in the years because of that. So, and as well as the audience. So it's good. The real issue is much more money is now project money. Everybody knows it's for this particular project, and we can often get some money for a project, although increasingly also funders want matching money, so you have to find it once and then you have to go out and find it again that will match it. But the biggest issue we have, the most difficult one, is the unrestricted. This is the general support, general operating support. The center used to get, when I first came in there, half of our money was general operating support, which was fantastic. That's just fallen down to a small percentage, and it makes it difficult. So we run a deficit, essentially, in the unrestricted part of the budget. We've started a new individual giving part of the center, which is working really well, and I'm very happy about how much money is being raised that way. But if it isn't unrestricted, which individual is, it really is a problem. And I think I'm not the only nonprofit in the country that is recognizing that, feeling it, seeing it. It's great to have we're going to do this work. We're going to continue to do this work, but it would be nice if there was some general operating to do it. That's just probably one of the biggest issues we face that my board, as Matt Thompson will tell you, is focused on very clearly.
And it's also, and David, maybe you can speak to this too, as a funder foundation, that most foundations tend to fund 80% or so projects rather than general operating support, but to talk about your commitment and what you see in the future for projects like this collaboration or that you'd like other funders to hear.
Yeah, I think Kaiser Health News was set up in a way so that the core was supported by the foundation's operating budget, but when there are particular needs like going to partner with NPR, it should be on, yeah. To go beyond what they can do with their own staff, our board of trustees will allocate money for a project, and we have to go back to them and talk about all the successes of the project and convince them to continue the project at future board meetings. And our commitment to NPR is a long-standing one, and I think one that will continue as long as there are health policy stories that aren't well understood. There's also, I think, a real need in a lot of communities we're not currently reporting in right now to do more health policy reporting. So we're interested in talking to other funders who would like to do something similar in their communities, because I think health is one of the biggest sources of government spending and a big factor in everyone's life, and it's poorly understood in a lot of communities how those factors are playing out. And I think journalism is a key way that people get information about it and a key way to try to expand what people know. So I think finding organizations that are willing to fund the core is always the challenge. They're interested in a project or a disease or a particular aspect of the health system that their money came from or that they're involved in. So I think it is a challenge to find organizations that are willing to support ongoing operating expenses.
And I would just piggyback on that and say that one of the reasons Kaiser and NPR have had this long-term relationship is that our goals have always aligned. Editorially, we set out and say, we want to cover this. It dates back to AIDS. When Kaiser was a grant-making organization, then I think this was when you were probably vice president, they came and they gave us enough money to hire a couple of reporters, and that boosted our AIDS coverage enormously and had a huge impact. And over the years, we've maintained that relationship, and it's morphed in many ways, but our goals have always been to provide solid, credible information to people that's not biased one way or another. And with that goal, that shared goal, it's been a match made in heaven, if I can say that.
And Joe, if you could just segue from talking about underserved communities, because it's one of the things that clearly at NPR and also PBS, I think, do is the ability to reach communities across the nation, but really rural communities sometimes not getting the kind of coverage, not being able to adequately provide coverage. You're also commitment to diversity. Do you want to just expand?
Well, this is one way that we're trying to do that. I mean, there are many problems with diversity in the public radio system and in public broadcasting in general. When we started this project, we really wanted to go find a diverse group of reporters, but we had to draw on what was out there, who the member stations had hired, and it was a pretty white group of people. We had 3 in the first group, but that's not what the country really looks like, and we really made a huge effort, and we're going to continue to make that effort. And that's what this project is about, is trying to reach into communities. And, over time, I think we'll get there. We're not there yet.
And it's also about what we decide to cover. No matter who the reporter is, if they go into Brownsville, Texas, they cover something that doesn't get covered. And so that's really, really important to us.
Yeah, and diverse voices are a big
and the Medicaid expansion will be a huge part of what we're doing now, and that'll affect this important, poor, formerly uninsured part of the country.
Yeah, we have always made covering Medicaid a priority, and I think we're one of the few news organizations that really does that. So.
Good. Well, I also know that we want to at least take 1 or 2 questions if you've been thinking about something that you'd like to add, inquire. Nope. This group is well satisfied. They've had lunch. Yes, there is
all questions
yes.
answered.
Thank you. Hi. When talking about the work that you've done in funding newspapers and commercial entities to do some of this health reporting, can you talk a little bit about what that's looked like and what are some of the expectations in working with commercial partners? And then Bill, when you decide who to partner with in terms of whether you're going to be actively engaged like with an ABC News or just wait until the story hits a critical mass and then others pick it up because it's just gotten that big, what does that look like and what are your considerations there?
Sure, well, I can start. We provide the funding and Peggy and John provide the editorial contact with the news organizations. I would say it really works when the interests are aligned most closely. So picking those commercial news organizations that care about covering the same issues that you care about covering, and making sure that you've got buy-in from the top, if possible, or as high up as you can go, to make sure that you're not just talking to a reporter or a small team. You're working with the managing editor or someone below the managing editor can really put institutional weight behind the partnership has been an important prerequisite for us in picking commercial media partners to work with.
It was interesting when Lorian McGinley and I, she came from the Wall Street Journal and I came all from broadcasting, we were the first two people hired to run it and to expand. And we would get into these periodic discussions with our bosses when they would say, well, the goal is to have, why aren't we everywhere? And Lori and I were both like, you are dreaming. This is not going to go too many places. These people consider us competition, and actually it has evolved almost daily this way. It's astonishing to me that the Washington Post, which at first said we wanted exclusive and we wanted for 5 days exclusive, we said everything we do anybody can take, but we'll start with you, and then we had to give these exclusive periods, which is sort of silly given the internet. But and now recently the Washington Post published a story that got published everywhere else. They published it like 2 weeks later, and it's like, oh my God, we have done what they said. And I actually said to them, if you think I can get a story on NPR in the first year from an outside news organization, there is no way. And we had it on within 3 months. And it's like, it shows some of the need, but I hope it shows also the quality of the work that our reporters do.
It's the quality. Yeah.
It's the quality.
And it was a gamble too. We didn't know that it would work out when we decided to create this. So there's
And
experimentation.
I was terribly fearful of funder fatigue, which has not happened. It's my 5th startup, and it's my first one as with a nonprofit. The other 4 were much well-funded, much better funded, and they all died really fast, including something that had $75 million in 1981 dollars, and it folded within a year. Like, whoa.
Well, a lot goes into, we have a project and we think about where do we want it and who do we want to work with. And basically there's different kinds. There's the kind after you publish and everybody just uses it, which we don't allow any exclusivity. We basically say it's up for grabs. The other kind are much harder. They're real collaborations. Today, I can tell you in Brussels, our reporter team, we have an international team, are meeting with 44 journalists, giving them a whole bunch of data that we have collected from whistleblowers that will lead to a big series of stories coming out in October, because we're giving it to them early and letting them do investigations in their own country, and then all agreeing when it will come out. Those are the big kind that go on a long time. The ABC one was a good collaboration with one exception, but essentially we gave it to them. We'd been working on the story 6 months and went to them with it and all of the data and all of the information, and they said, oh, this will be good television, so they came in and worked on the television side of it. And then other people have used it. We also took it to the Charleston, West Virginia Gazette in the heart of coal country, and it was their big Sunday spread with the weekend that we came out with this, and they've continued to follow it. It was a very important story for them. So we kind of pick in our own mind. We want national partners. We want to show where it can be. In some cases, it's a local partner that we'll use. And then we'll work with them early, and those are more complicated. But we're sure the work that we're doing is of very high quality. We're going to do the libel review, we do the fact checking, we do the extra levels of editing, so whenever we give it to them, we know that it's solid and they can localize it or not after that. But it's a big part of the operation is where else is this going to run and who are we going to use and who do we talk to? We just this last week started working with Quartz and Vice. Now I'm sorry, I don't really know those, maybe you do, but they've given us a whole lot of traffic. We're on Huffington Post every day when our work comes out. But so is Slate and Salon and Daily Beast. I mean, they're all picking it up, and so we're happy that all these places. I think it's the visibility of the center has grown because of that.
Thank you. Well, there are also, I think, Joe, you've also talked a little bit about at NPR in terms of another kind of collaboration, sometimes with funders and having to say no sometimes because you want to make sure there's that firewall, if you will, between content and interests. And
right.
Again,
The editorial firewall is very strong at NPR. In fact, it's right here above my head. But what really makes it work is that we have a complete editorial control. There have been instances where I understand no has been said because it didn't align with what we wanted to do. More often, though, I think we go after the people that we sense are going to be aligned with us. We have a great partnership, an editorial partnership with the Robert Wood Johnson Foundation. They fund 4, I think, public opinion polls on health-related subjects each year, and we do that in collaboration with the Harvard School of Public Health. And just very high-quality stuff. The foundation, and this goes back to something that was said earlier, I think by Laura Walker, initially the journalists were very skeptical about having input from the foundation, but it's a collaborative process where they're the ones who are the experts in healthcare. They have a huge number of funders, grantees, who are at the cutting edge of medicine. We want their information, we want their input. So when we get together and we say, our next poll that's coming out in July, mid-July, is on stress in America, and we look at the question of how much stress have you experienced in the last month. Well, in developing the questionnaire, we used the experts at the foundation, the experts at Harvard who know all about polling, and we had our own editorial questions. And in that way, we collaborated, and we feel very comfortable about this because whatever we put out on the air with NPR's name is going to be something that I've signed off on and that my reporters have signed off on and have been very comfortable. And it's, and the firewall is what helps make that work in many ways. But we're not afraid to collaborate with our funders when there's real expertise there that can help us.
Well, multiple forms of expertise with each of you, but maybe to conclude just this portion of this, I guess, headlines that we're able to offer in the storytelling, to really talk, if we were all to come back, say, in 3 to 5 years, how might the intersection between public media, it's evolving, changing, and healthcare coverage look to you? Are there trends, issues that we haven't mentioned at this point? Do you want to make a prediction? You have a crystal ball? More funding?
I wish. I think more funding would be good. I think there's a real need. Healthcare is a very personal experience for a lot of people. There's a real need for more, I think, participatory journalism where people are contributing their experiences with the healthcare system and models that get that into the hands of professional editors that can put it out. I think taking the stuff just as it's put out without any context or fact checking can be problematic, but I think there are models where you could take people's experience with the healthcare system in a much more participatory way and share that. And I think there's a lot of big changes that are, obviously the Affordable Care Act has brought a lot of big changes, but there are a lot more that are going to come as we get into budget debates about Medicare and changes to programs that are difficult to afford at our current tax base. So I think there's a real need to get that experience out there. I think also long-term care is a big issue in people dealing with a system that really is different in every state and every community of how to take care of people's parents and the elderly. And I hope that there will be more journalism around that because I think it's a very personal experience that everyone sort of discovers on their own and then finds out that everyone else had to do the same thing. And go through on their own discovering how the long-term care system works. So hopefully in 5 years we'll have a much better base of reporting around that for people.
Great, good, thank you, David. Peggy?
Oh, that sounded really good in terms of we. I like that.
And Kaiser Health News will still be there.
I have witnesses. I think that the definition of public media, I'm a little confused about to this minute because I've worked a lot in public broadcasting, but is Vox public media? It's out there, it's free on the web, it's new, it's being supported by in a philanthropic way. Is that part of our mission? I don't know. With all these new organizations, new news organizations that are being well funded by good intentioned people, will they still be around or will they fold? And what role do we have with them? I think that's a real interesting question, but I guess I still expect us to be providing excellent coverage.
Excellent, good, Peggy, thank you. Joe?
I would just briefly say that I hope we're doing everything we're doing now, but more. I would like to see, many years ago when I started out as an AIDS reporter and have worked many years to get more funding in global health and development, and the Gates Foundation has been very generous to us in this area for many years, but most recently just in this past year. I'd like to, my next goal is to create a vertical in domestic health care that can really focus our resources and provide this whole structure of support, core funding that you were talking about, that is so hard to come by. And I would try to steer us more in the direction of covering business of health. That's a real gap that we have at NPR. And I would do almost everything that David just said. I'm very interested in long-term care. So that's sort of where I see it editorially.
Thank
where
you.
we might be going.
Thank you, that's great. And Bill, you get a special perspective, right?
Well, I think there's no question in the next 3 to 5 years we're seeing an incredible proliferation of all kinds of news organizations with specializations of different kinds, which is right. But I do think if I were to look at the center, I think it's a hub. So much of some of our international work, it's a hub for now 185 journalists in 65 countries. I think we're going to be a hub for a lot of the state capital investigative reporting going on because we're gathering things on every state. So I see this sort of hub and spoke issue going on with lots of places to get information, and then the really quality ones are the issue. How to make it absolutely, bulletproof when it comes out. That it's clear. It's, again, in our case, we love it based on data and documents. But if you make it really good and it travels, we're providing the public media space is providing, I think, the news and information that a democracy needs. You can keep doing it.
Well, that's terrific. And as we all talk about the excellence in media that matters, we also want to segue to the fact that last night we had the Media Impact Festival, which I think was the first time, Vince, that the Media Impact Forum was really organizing and doing solo, and it was exciting, I think, to be presenting a number of awards, one of which was given to Amy Ziering for Invisible War, and it exciting, I think, it also addressed a very serious public health issue, and we wanted to be able to show, for those of you who were not there last night, I think how she has courageously, along with her partners there, addressed the raging epidemic of rape in the military. And so I believe, Sarah, we're about to show you a clip.
Read my lips. The military must end rape.
There's a new documentary, a very important one, and it proves that the ugliest battles sometimes can take place far from the front lines.
Everything changed the day that I was raped. He hit me in the head and knocked me out.
I remember holding the closet thinking, what just happened?
A month later, I found out I was pregnant.
In The Invisible War, filmmaker Amy Ziering, along with director Kirby Dick, set out to expose the epidemic of rape in the United States military and document the failure of each branch to protect its own servicemen and women from sexual violence.
There's an embedded serial predator problem, and these crimes are not being prosecuted. And no one is doing anything about it. And this has been going on for decades, and it's time for a change.
People would contact me and say, well, I have a story, but why are you so interested? Because they didn't even know this happened to other people.
Really?
Because imagine if you're 18 or 19, you enter the military, this happens to you, you're not given any help and support, you're blamed, and then you start thinking, right, without any therapy or help or knowledge, maybe it's me.
What's going on is you have an extremely small percentage of people exploiting a system that's flawed.
Using Department of Defense statistics with rape survivors and their families, the film exposes not only the rampant sexual assault found in our military, but also the systematic cover-up and punishment of the few survivors that report it.
I reported it 2 different times to my squad leader. And he told me that there is nothing he can do about it because I didn't have any proof.
If a man gets accused of rape, it's a setup. The woman's lying.
They did charge me with adultery. I wasn't married, he was.
The audience award goes to The Invisible War.
And the Spirit Award goes to The Invisible War.
In the few months since the film's release, The Invisible War has done what advocates and politicians have been trying to do for decades: change United States military policy. 48 hours after seeing the film, former Secretary of Defense Leon Panetta transferred the decision to prosecute out of unit commanders' hands and up to the rank of colonel.
We've been very heartened. It's been incredible. The response from the military has been extremely, extremely positive. In fact, Secretary of Defense Leon Panetta saw the film and 2 days later held a press conference to announce significant policy changes, which he himself said was a direct result of the impact the film had on him.
While the goal is to take the decision out of the military entirely, the move is a step in the right direction, and only the first step of many for which this film is responsible. In fact, since the film's release last year, it has inspired the proposal of 16 new pieces of legislation, several of which have successfully been voted into law. Additionally, it is estimated that over 250,000 of our service members have watched the film, and it is now being used as a training tool on military bases throughout our nation.
Most people in the military are horrified by this. And when we have shown the film, we've gotten remarkable response. They're hearing the film as a critique, not an attack.
The movie is so powerful and is such a game changer because it is able to lay out that it's not an isolated thing, it's a real epidemic. It has not been tackled and has not been fixed.
So I think you can tell why this won the Henry Hampton Award. I think last night we talked about the importance of an image, a sound, the power of a story, the excellence of the people who can bring this to an audience and engage them. We talked about illuminating some of the dark corners of our world, and also Henry Hampton, as has been said about him, how he can heal the world with the truth. And I think all of our panelists today certainly know all of that, and we're deeply proud to know all of you and to have you tell part of your story here today. So thank you, Vince, and thank you all of you for your time and being part of this. Thanks.
Thank you. And you did a fantastic job. Got everything.